Okay, so now we're going to look at how we can modify the session we just performed for specific populations. Firstly, we're going to look at hypertension. So hypertension is a chronic condition of elevated blood pressure. It occurs where your blood pressure is above 140 over 90. Normal blood pressure is usually around the mark of 120 over 80. Some of the things we want to keep in mind when we are training clients with hypertension is to do unilateral movements. This is going to reduce a spike in their blood pressure. So doing movements such as a one leg press. So instead of a squat, we might do the one leg press. Instead of a bent over row, we might do a single arm row, resting that one arm on the bench and knee on the bench. We want to reduce overhead presses, so anything where our limbs or where the client's limbs are above their heart or their head, we want to reduce that to cut out the risk of spiking that blood pressure. So for example, with the push-up and the chest press that we conducted in the session just earlier, we would want to elevate the client's body. So whether that's doing a wall push-up or doing an incline chest press on the bench, or we could even move to an upright chest press machine. In terms of the cardiovascular side, we want to keep the intensity level low with aerobic cardio. We don't want to do anaerobic, really high intensity training with these clients straight away, otherwise it's just going to spike their blood pressure. And in terms of sets and reps, we should be looking at doing one set for each exercise, anywhere between 8 to 12 reps. Again, if we're doing more sets, more volume, this is going to increase their blood pressure, and that's what we need to steer clear of. Okay, so next we're going to look at a client who may have lower back pain and how we would modify or work around certain exercises to come up for a session for them. So lower back pain can be either chronic or it can be acute. It can be caused by a range of things such as injuries or maybe previous surgeries, or even something as simple as muscular imbalances or really tight hip flexors. So the first thing we want to do is check with the allied health professional with this, just to make sure they're fit and they're ready to train. So with a client with lower back pain, first thing we would want to do is to make sure that they have good hip mobility. Oftentimes this can be one of the major causes of lower back pain due to really tight psoas muscles. So if we can stretch those out, get the hips mobile again, that would be one of the first things to do before we train. The next thing is we want to take direct pressure off the lower back in the movements we do. So for example, with the push-up, we might move to a wall push-up. This will take the strain off the lower back, where you're not holding yourself up off the ground and you have the majority of that weight on your lower back. For the barbell row that we performed, you may want to go to a single arm row, again to take that pressure off the lower back, or even a seated cable row. For the barbell squat that we did, we'd want to reduce that weight maybe to just body weight squat, where it's really light, again making sure they have good hip mobility, they're keeping their back straight when they're doing it, and they're not hunching forward when they're coming down. We may also want to do a lunge for this. In terms of cardio, again, we don't want to aggravate that lower back and put a lot of strain on it. So things like running on the treadmill is probably not the best idea. However, we could move over to the bike where they're sitting down, the pressure's off their lower back, and they're working their legs as they're doing this. So lastly, we are going to be talking about a client with a knee injury. So the first thing we want to do with a client who has a knee injury is to find out the stage of their injury. When did it happen? Is it more acute? Has it been a few weeks, or is it more of a chronic injury that is persistent? Is it anything like arthritis or anything like that? So we want to confirm with the client and also the allied health professional. So once we have done this and we have a good understanding of what the injury actually is, we want to be aware that providing the injury isn't on both knees, that the range of motion and exercises that we do which will involve the knees, the client is probably going to favour the stronger leg. And this is something that we don't want to happen because it can cause muscular imbalances. So for those movements in the program we just performed that predominantly use the legs and the knee joint, such as the barbell squat, we want to, if the client can squat without favouring the other leg, we might just want to do a body weight squat, but otherwise we want to be doing unilateral movements where they are getting the same force on both legs at a lighter weight, but to ensure there's no muscular imbalance that's happening. In terms of cardio for knee injuries, again, we want to take that direct pressure off the knee. It will depend a lot on the stage of the injury, but something like the bike is a great way to get mobility happening within the knee without putting direct hard pressure on it.